Tonight on The New Reality,
Yes, this was predictable.
the unseen crisis,
COVID-19 is hitting communities that are socially and economically marginalized or disadvantaged hardest.
tale of the test,
We work behind the scenes to provide results that the doctors need.
People were clapping.
calling in the troops,
This situation is so dire. People need help.
a curtain call for theaters,
There have been plagues, there have been viruses, there have been pandemics, and it's always come back.
and the zoo reality.
We need to make sure that we're not just leaving those animals without support.
Hello, I'm Donna Friesen. It feels like our future rests on tests right now. Tests to see who is positive for COVID-19, tests to see who has antibodies to COVID-19 and might be immune. No country knows the true picture of the spread of this virus because no country has tested everyone. Here in Canada, almost 1.5 million Canadians have been tested for COVID-19 so far. That's less than 4% of the population. The more you test, the easier it becomes to track the spread of the virus and reduce transmission. That's especially important as we start to open up the economy and get people back to work. Tonight, Jeff Semple dissects the intricate anatomy of a COVID-19 test.
This has become the new focal point in the fight against COVID-19. These aren't frontline doctors or nurses. Instead, they're laboratory technologists and technicians. And these days, they have their hands full.
Everyone is trying to ramp up with the testing abilities.
Humber River Hospital is home to one of Ontario's 26 labs tasked with testing, handling potentially hazardous samples to determine whether a patient is infected with COVID-19.
We work behind the scenes to provide results that the doctors need.
This is a negative one, only one line going up.
And those results are now needed badly. As businesses reopen and restrictions are lifted, knowing who is and isn't sick could mean the difference between preventing a second wave of the virus.
Testing is key to understanding when new cases arise so that we can descend upon them with overwhelming force and suppress those handful of cases from becoming an outbreak.
From the start, the priority has been testing frontline care workers. Like 35-year-old Lajomi, the mother of 4, works in a care home for people with disabilities. And last month, she suddenly lost her sense of smell.
My mother-in-law was frying fish one day, and you know how fish smells? I couldn't smell it. And I was like, why can't I smell it? And then when I was trying to eat, I couldn't taste it. And I know I didn't have a cold at that point, and it lasted a long time. So that's when I knew that something was clearly wrong.
Any symptoms at all?
So Lajomi came to this assessment center to be tested for COVID-19. The test itself is pretty simple. A quick, albeit uncomfortable, swab of the throat or the sinuses.
You have to open wide and say ah. Keep saying ah.
The whole process is over in less than 30 seconds. But the sample placed in this test tube still has a long way to go. Only high-risk patients, the very sick requiring surgery, will have their tests processed here. The rest are labeled, placed in a cooler bag, and picked up by a courier. Then driven to different labs across Toronto, where they join the queue.
Not all labs have the capacity to process large volumes of samples, so that might influence the delay on results.
And capacity remains a concern. When test results arrive at the Humber River Hospital lab, they're taken to a separate area, through 3 sets of protective doors and negative pressure rooms. First, staff put on their protective gear, then carefully move the nasal swab from the test tube into one of these cartridges, before placing it into this specialized machine, which analyzes the DNA for 2 genes connected to COVID-19. It doesn't take long.
This is the N2 gene, and this is the E gene, so specifically it's detected and it's giving a result of a positive result.
It takes less than an hour to reveal the patient is positive. But this is the lab's only machine from an American manufacturer, and it can only process 16 tests at a time. And the tests themselves are in short supply.
Prior to this year, there was nobody developing that test. So every company that's now developing that test has had to ramp up production. There are supply chain issues and there's huge demand for the test. It's as simple as that.
The result? This high-tech lab, which conducts more than 10,000 tests for other diseases each week, can only process around 200 weekly tests for COVID-19.
I do wish that we had more testing capability so that we could be more informed with our decision making.
We're going to ramp up this testing like this province has never seen.
Ontario and Quebec, the provinces hardest hit by the pandemic, are also having the toughest time with testing.
They told me flat out, no, you don't need a test.
This Quebec care home worker lied about having symptoms so she could receive a test, and her result came back positive.
I couldn't believe the fact that I had to fight and lie to get a test.
Her story underscores the importance of testing, because many cases are mild or even symptom-free.
We need to do surveillance testing. We need to try and get a measure of that portion of the iceberg that's under the water, those asymptomatic cases. We need to do that before we open.
Alberta is now doing just that, testing residents in Calgary and Brooks, regardless of symptoms.
Alberta has lessened the criteria for testing, which is key. They have allowed a greater number of laboratories to participate in the testing process. For a while in Ontario, for example, only the public health labs were engaged in the testing capacity, but we needed to loosen up those criteria to include commercial labs and university labs. It's an all hands on deck scenario.
After 3 days of waiting, Lejomi's test result came back positive.
I was scared, to be honest with you, because I have my mother-in-law, I have my children.
That was back on April 14th. After a couple of weeks, her symptoms disappeared and she went back for a second test. But those results came back positive again.
All they told me is that now that I already finished my 2 weeks isolation and I have no symptoms whatsoever, that I can go out in the community, but make sure that we do social distancing. You can't blow this one.
She's now been tested 5 times, all of them positive.
Smile, guys.
Fortunately, her husband tested negative and her children never developed symptoms.
So I'm just waiting for that negative so I can really get back to work.
Yeah. The molecular test is so sensitive that it can pick up viral genetic material even in the absence of somebody being sick.
And the hospital lab director says they're about to add a new test, serologic, a made-in-Italy blood test just approved by Health Canada that checks a patient for antibodies.
That tells you how many people have been exposed and have hopefully partial or complete immunity versus people who haven't been exposed, and it helps you more with public policy decision making.
This lab plans to start conducting serologic antibody tests by the end of the month. The better the testing, the greater our understanding of a virus that in many ways remains a mystery.
The virus is a mystery that's making lives a misery. Even before we'd ever heard of COVID-19, there were people living on the edge in this country. More than 3 million Canadians live below the poverty line, and about 4 million have inadequate access to food. Now they're slipping further. Alison Vushnik reports on the vulnerable who live on the margins of society and need help now more than ever.
Here, the pandemic cuts through, exposing the cracks, the inequities that have long existed. The borough of Montreal North is one of the most devastated areas in the country. The COVID-19 infection rate is close to double the average.
We can see that COVID-19 is hitting communities that are socially and economically marginalized or disadvantaged hardest.
Among those who already live in difficult situations with lower incomes, many are also frontline health and essential workers. All that contributed to the spread.
They're working in occupations that already paid very little, but now have been deemed essential, right? And because of that, because they already didn't have savings and they have families to support, they have to go to work to put food on the table.
living in multi-generational, racially and ethnically diverse, and high-density settings.
People start to realize that the disproportionate impact that COVID-19 has on certain population groups.
While Canadians were told to stay inside, many of the most disadvantaged had little choice.
I think about people that don't have access to a car, for example, so they have to take public transit. So they might just have to be in settings where they are mixing with other populations at a greater frequency, and that's going to increase risk of infection.
These critical issues are called the social determinants of health. Social and economic factors like income, discrimination, access to quality food, healthcare, and education. All of it impacts a person's health and how long they will live.
Also, these are groups that generally have already suffered long-standing health inequalities, so they're more likely to be sick already. So it's really a variety of factors that lead to them being much more vulnerable to both getting COVID-19 and suffering really terrible consequences from COVID-19.
Those who study public health say this was predictable. The inequities existed before the pandemic hit and in communities across the country.
Once the infection became more community spread, we saw these gradients across socioeconomic status that have widened over the course of the pandemic.
It's not just about who gets infected. The pandemic is also impacting those in less secure and low-paying jobs. Statistics Canada says they have suffered greater job losses. In the shadows, they are suffering. The most vulnerable, struggling before the pandemic, now even worse. It's almost impossible to have good health without stable housing. The shelter system already under-resourced, scrambling to cope with physical distancing and caring for this at-risk group. The virus claiming lives.
It's just such a difficult situation. Any congregate living situation, this virus has proven to be extremely contagious and spread very easily.
And there are others struggling. Many of those with disabilities are suffering with programs canceled and services reduced. And so many seniors are isolated at home. To understand how great the need is, you need to go to the agencies and charities that are supporting the vulnerable. It's been tough for them as well. Donations dropping, physical distancing, and the need rising.
And the numbers have increased exponentially. The people that were in the lineups before COVID are still there, and now there's twice as many.
Second Harvest is Canada's largest food rescue. It is in the intersection of two problems: a food system with too much wasted food and too many people going hungry.
When COVID-19 hit, it really magnified the existing problem, and then it created an even larger scale challenge, both with the amount of food that is going into landfill and the amount of people that really need to access this food.
That's where foodrescue.ca comes in. If someone has food to donate anywhere in the country, they are connected with a charity in their local community who needs it.
Over 60,000 organizations in Canada, 60,000 use food in their program, charities and nonprofits. So we need to map those charities with the 58% of surplus and lost food to make sure that it goes through the system. And so we do that with a matchmaking system that I refer to as the eHarmony of food, because it's really simple.
Since the pandemic started, the website ramped up in March. It has helped to rescue close to 7 million pounds of food and help thousands of charities. When the Second Harvest trucks roll out, they head to charities like the East Scarborough Boys and Girls Club. These halls, usually loud and lively, now quiet. The Programs and Center is a lifeline for so many. From children to seniors with its multiple programs, it helps close to 6,000 children and youth every year.
It's unprecedented.
Now the help is coming in a new form. The club is receiving additional food from Second Harvest, then packaging hampers.
It's been a huge challenge, but an opportunity, I think, across the sector and for us locally to look at how we can scale up our services to make sure we are not letting anyone fall between the gaps.
Twice a week, staff members are personally taking the food to families who need it, so far delivering more than 5,000 hampers. Damilola is trying to keep her 7-year-old busy and safe. As a single mother, she's still working from home, but her hours have been cut back. Paying for rent and food and all the bills is no longer possible.
Then you start to worry about, okay, your finances, what's going to happen, your credit card, what are we going to do about that? And then your rent. Thank you.
So for the first time, she's receiving food hampers twice a week.
They do help every week, so that's a very good initiative and we're grateful.
Okay, you're catching up to me.
She's grateful and this works for now, but if her rent returns to a full amount and her income is still reduced, she could get into trouble fast.
If I was paying my full rent and groceries, there's no way I can meet up because there are more bills to pay and then the income is not enough at this time.
Back at the Boys and Girls Club, they know people are anxious and need more help. They are now offering education supports and virtual activities.
We've started to do analysis across the community through our assessments, and the reality is that looking at the metrics, it may take almost a year of these continued emergency type supports to support families so that they can balance out and resume some type of normalcy.
And that raises a critical part of the social and economic factors of health, data, to see who is being impacted and how best to help. But the collection of this information in Canada has been inconsistent at best.
When we're missing data on segments of the population that are at risk, it really hinders our ability to make sure that our responses are protecting those people, or in worst case scenario, not making the situation more risky for certain groups in the population.
It also means we need to be better prepared for targeting help before the second wave of infection starts.
The one thing about infectious diseases is that we neglect groups of the population. That means that the outbreak will continue. At any point in time, to understand that anyone being infected means everyone could be infected.
That challenge could also present an opportunity.
In place of saying reopening, we say reimagining. And I think one of the ways we need to reimagine our society is in a way that will reduce the deleterious impact of these social determinants of health. Almost every single health problem you can think of really breaks down along socioeconomic gradients, and the most vulnerable people always bear the worst brunt of these health problems. This might be a sort of small window when we can reimagine society to break that cycle.
There's lots of help needed, lots of things to fix. With me is Dr. Andrew Boussari. He's Executive Director of Health and Social Policy at Toronto's University Health Network. Doctor, at the start of this pandemic, the virus was referred to as the great equalizer. That's not really true, is it?
No, Donna, the more and more we're learning, the more and more we're seeing, there is nothing equalizing about COVID. It is really a cruel exposer of longstanding inequality and poverty. We're seeing this concentrate with the data. We're hearing this with the stories. But really, none of this is surprising. But that's also what's compounding the crisis and what's making it even more worrisome.
For people who aren't on the front lines like you are, can you explain how the lack of safe housing and poverty intersect to put people at greater risk of getting COVID-19?
COVID has, torn back the curtain on any sort of way to ignore this, of any sort of way not to see the connection. If an individual is experiencing homelessness, they do not have places to physically isolate. They are constantly at risk. They are constantly in situations where they're not able to also have any usual or what we would hope for healthcare delivery or healthcare access. And then I think the other challenge on this has also been it's for the underhoused, right, as well, that we're seeing these issues of where physical distancing is a privilege. It has not been afforded to all. And what we're seeing it come up with COVID is that it's really coming at the cost and the expense of the poor. There needs to be an opportunity for individuals to have the human dignity and the protection that we would expect and demand for everybody living in Canada has not played out. So I think, again, there is incredible heroism by the individuals who are experiencing this every hour of the day, who have had to look out for family members, for themselves. There is incredible courage by the frontline shelter staff, by community workers who are in shelters, who are in the facilities to do all that they can to help individuals, from our healthcare workers in hospitals. But really what we're seeing is that this is not a fault of any individual. These are not faults of any collection of individuals, but these are structural issues and system level elements that have now been exposed, that have been, I would argue, exposed for a long time, but are now really unignorable.
We're starting to open up the economy now. How are marginalized people in society more at risk as that happens? Are they more at risk as we start to open up? Or have some supports been put in place for them? Are there safe places, for example, for them to quarantine or recover if they've been sick?
I think that the reopening comes with really serious risks for those who are already most disadvantaged. We've seen this from data where it's individuals, again, who are at the front line, but who are individuals who we've called, essential workers now. But for a long time, we also had no issue calling unskilled or minimum wage, but they have had maximal courage in doing what they need to do to allow whatever parts of the economy have stayed open, whatever parts of services have stayed open, have really been through the courage and dedication of these workers who we've deemed essential. And I hope that we also continue in that same respect and that same view of the things that they need to happen. And really, I just think it's about individuals being able to have the confidence and trust in the system as things reopen. The economy will never come back to life if there's no confidence. And I think that the other piece of this is we will never see the health outcomes we want if there's not trust in the system, that people are not going to be overlooked, that people are not going to be neglected, and people are not going to be, essentially sacrificed for certain parts of the economy to restart, while individuals, again, have been under chronic neglect. And now it's not hard to connect the dots as to the risks that they're under.
Do you think that we're opening up the economy too quickly?
Those who are most at risk of this with the opening of their economy are racialized, marginalized populations. We've seen this with personal support workers, again, where this has long been known that it's usually racialized women in these situations who've been under precarious employment, not having the control and autonomy that we would hope for everyone working in our healthcare system. They've had to have, this courage and this dedication for years. And again, COVID has blown the top off any of these issues of where people have been in precarious work, where people have been in unsafe work conditions. And so again, when the economy reopens, it's those individuals who will be at the forefront. It's those individuals who will face the consequences. And I think, again, we have to go back to decide, what do we owe each other? What elements, what levels of protection need to be in place before we can safely reopen the economy?
Still ahead.
I want to see the lions, the bison, the grizzly bears.
Drive-through zoo.
A plan that allows people to stay in their vehicles, get a behind-the-scenes, unique experience.
The new reality of a trip to see the animals. Plus, performing post-pandemic.
I'm looking forward to the future when we can have human connections again.
The reality of getting Canadian artists back on the stage. And troops facing an invisible enemy.
It's a lot of work, but it's a good work that we're doing.
Canada's armed forces pitching in where it's needed most. For those with loved ones in long-term care, the wait has been agonizing. For more than 10 weeks, they've been unable to visit in person, unable to hug or even hold the hand of the person they love. Staying away is supposed to stop the spread of COVID-19, but we know it has already spread like wildfire in hundreds of homes. It's so bad the military has been called in. No one ever thought soldiers would be looking after seniors. Yet, there they are, 1,400 troops deployed in 25 long-term care homes in Quebec and 275 working in 5 facilities in Ontario. How did it come to this? Mike Armstrong takes us through it.
Even before there was a request for help, the Canadian Armed Forces were preparing, planning for what might come. In a normal spring, it's usually flooding or forest fires, but by this meeting, April 6th, there was also the increasing likelihood troops would be needed in the fight against COVID-19. The coronavirus was already sweeping through seniors' residences in Quebec and Ontario. The death toll was rising. What it was also doing was exposing the fragility of the system. Even before COVID-19, Quebec's long-term care facilities were already struggling with staffing. This took them past the breaking point. Some residences lost more than half their staff to infection, to preventative leave, or even out of fear. A desperate premier called on anyone in the healthcare system to help out.
We need you to do the basic work. I appeal to your sense of duty to help us take care of the elderly.
Those appeals went out daily and didn't work. There were more and more stories about overworked staff being overwhelmed. Canadian doctors who volunteer in other countries on humanitarian missions were told by Quebec's health minister to stay home.
What I'm saying is that this year now, I think the humanitarian mission is here in Quebec in our long-term facilities.
The first call to the military for help was April 15th. It was a Wednesday. By the Saturday, troops were out on recce visiting residences to see what was needed and where. They were very welcome.
People were clapping. Listen, this situation is so dire that people need help.
By that Monday, April 20th, about 65 troops moved into 5 Quebec residences. That first phase was soldiers with medical backgrounds, physicians, nurses, orderlies, and they were able to jump right into the action.
Well, we barely got in and we were already working knees deep in it. We were put to work as fast as they could.
Now, despite that initial response, staffing shortages turned into a full-blown crisis. There were cases where residences saw their entire staff not show up for work. It reached the point where COVID-19 wasn't the only thing sending seniors to hospital. It was also inadequate care. There were cases of dehydration and malnutrition. April 22nd, the premier put out another call.
The situation in senior residences is still critical. Today, we've asked the federal government to send 1,000 soldiers.
The second wave of soldiers was more complicated to deploy. They needed training in how to use protective gear and some of the basics in how to care for seniors. The tasks were similar to what an orderly might do and very different from what most troops signed up for. But once on the ground, they knew they were needed.
It's a lot of work, but it's a good work that we're doing. We're taking a lot of the stress out of the civilian employees that are working there full-time.
The troops have been called extra arms. Even if they don't have the medical background staff would normally have, they're helping. How much? When we put that question to this nurse recently, she answered with exasperation.
À quel point? À quel point?
Martine Robichaud says the soldiers have let her and the rest of the staff breathe and made them feel supported. She also said they're already nervous about what happens when the soldiers leave.
Operation Laser is the name of Canada's military response to this pandemic, and Colonel Tim Arsenault is the commander of it in long-term care homes in the Montreal area. He's leading the teams of reservists and regular force members who are not only from Quebec but from all over Canada. Colonel Arsenault, thank you so much for joining us. You served in Bosnia and in Afghanistan and in Ukraine. You're an infantry officer. Now you're helping in a war against a virus inside care homes in Canada. This isn't what anyone in the military signed up for. What's been the greatest challenge?
It is a significant challenge to operate in a pandemic environment, especially at home. I think a year ago, none of us would have expected that we'd be involved in a mission of this nature. However, our business is adapting to challenging environments, and our soldiers have definitely shown that we're very capable of adapting to this one as well.
Give me a sense of the logistics. We know that one of the main reasons care homes are so badly infected with COVID-19 is because staff prior to this were moving from care home to care home and working in multiple facilities. So how are you ensuring that there isn't the kind of cross-infection and that enough care is taken that both your soldiers and people inside the care homes are not going to get COVID-19?
As you know, we're used to deploying in large numbers, occupying camps, large groups of soldiers living together, traveling together, working together. This situation is very different in that we need to make sure that we don't become vectors of the virus within the homes, as you've pointed out. That entails a lot of changes in terms of transportation, feeding plans, bed down, in terms of having each soldier needs to have their own room with their own washroom to ensure that we don't pass it off to each other and then again into the homes. And in terms of the cross-pollination between centres, we're applying the same rules as the ministry is. So our teams, in general terms, are not moving from one facility to the next. And those specific medical teams that are more of a limited resource, when we do need to move them, it's done in accordance with provincial regulations in that regard.
How many soldiers have tested positive for COVID-19, and have any become seriously ill?
I'm not at liberty to speak of the specifics of the numbers as they are today, or I can tell you that the numbers will increase. The numbers are very small given the number of troops that we have working in long-term care facilities.
Well, everyone very much appreciates everything that you're doing, but as the Prime Minister said, soldiers really shouldn't be taking care of seniors. Is Operation Laser kind of an indefinite operation at this point?
You'll note that since the end of April, we initially provided support to 5 long-term care facilities. We sharply increased that over the course of the first few weeks of May to 25 centres within the Montreal region. Again, over 1,000 soldiers directly involved in the long-term care facilities. We have around 1,400 soldiers in the Montreal region in total, including the logistics and command and control elements. So we're here to provide that assistance for as long as the government asks us to do so.
Coming up, bringing down the curtain.
There's something that happens when there's a screen between the audience and the human who's performing.
Setting the stage for post-COVID performances. Many of us have been binge-watching shows and movies from the comfort and safety of our couch, and all those things we used to do together, theater, concerts, comedy clubs, they're a distant memory. The idea of being packed into a place with hundreds of other people is still largely unthinkable. While some countries are starting to reopen their movie theaters, we still don't have a release date to return to Canadian cinemas. And traditional theater isn't expected to raise its curtain to the public until sometime in 2021. Artists, musicians, and actors are all struggling. And as Robin Gill explains, they're coming up with new ways to get creative.
The neon lights on Broadway are far from bright. They're not even on. But Shalina Kennedy isn't deterred. The Canadian actor and musician had the starring role in the musical about Carole King's life. When COVID brought down the curtain in New York, Kennedy was in rehearsals and fittings for a new production.
When I knew I'd have to face.
She made a run for the border, and these days, like everyone else, she's hunkered down at home in Ontario. The lights will come back on, she insists, but with no idea when.
I think we will go back to traditional theater, and I think we must go back to traditional theater because there is a name for virtual theater, and it's called film and television. And I think that we can't replace, there's something that happens when there's a screen between the audience and the human who's performing.
May you always know the truth.
The Social Distancing Festival is hoping to fill the void for the productions that have been disrupted or delayed. It's a platform that offers a way for creative types from around the world to collaborate, whether it's dance, art, or music.
But I think it's sort of important for all artists to figure out ways to translate their work to digital means, just to have a broader reach.
Nick Green, a Canadian playwright, is the brains behind the festival. He sees himself as an artist matchmaker and wonders if this could be the future of the arts.
There were a lot of efforts being made to figure out how to translate the arts to digital means. There were already grant programs and a lot of industry leaders trying to look at that question. I think this has expedited that question a huge amount.
And live from Zoom, it's sometime between March and August.
Life in the time of COVID is forcing actors to get creative in the Zoom room. Take Saturday night, not so live. The skits and improv have a flat feel.
How about you? What you working on? Not sure. I don't know.
No, I don't believe that will be the norm. People are looking to get back in the studio, and it's a little bit limiting in terms of what you can do without any interaction.
Jennifer McCarran is the CEO of Thunderbird Entertainment, the Canadian production company behind Blade Runner 2049.
They know you're here.
She says Hollywood will get rolling soon. Movies and TV shows have been shot. They're just waiting to be produced, both for the theaters and streaming services.
Content's a business that does well in times of recession. It's an escape. Netflix set the standard, and now we have Disney and Apple and Hulu, and all of those aren't startup companies, and they're coming online into streaming because it's such a hugely successful business. And now people can watch content anytime, on any device, anywhere, in 190 countries, 40 different languages. The reach that has is tremendous.
This independent cinema in Vancouver has been showing films since 1935. The auditorium isn't a full house anymore. Moviegoers will have to respect social distancing rules, so seats have been taken out, reduced from 40 rows to just 20. And the types of movies will be geared to a certain demographic.
As we open up, we're going to cater to those people that are younger, for sure, that don't have the same degree of fear. Young male films are going to do better than young female films. Males tend to not have the same degree of fear that females do.
In the interim, traditional theater will take an intermission.
We may just be pressing a pause button for a short period.
The rehearsals are still taking place, even though the opera season has been postponed until 2021. During this interlude, the soprano solos won't be silenced. Instead, the audience will experience the virtuosos from their virtual world.
There's no question that the emotions that opera brings out in humans will be lost somewhat online. The most important thing in producing online will be the sound quality. Opera obviously is all about the voice and it's all about music. So making sure that the sound quality of anything we put out online is the top level we can produce at. I'm looking forward to the future when we can have human connections again, because it will be the cultural sector that restores everybody back to some sort of normality, some sort of emotional high that we all get when we go to the theater. And you're right, we will not get all of that in the living rooms of one's home.
Toronto's Royal Alexandra Theatre was closed during the Spanish flu in 1918. It eventually reopened. 100 years later, it's the same refrain. COVID-19 will keep theaters shuttered until 2021, when it's hoped players and patrons will come back from being away.
Theater has gone on for over 2,500 years. There have been plagues, there have been viruses, there have been pandemics, and it's always come back. I have to believe that it will come back again.
South Korea suspended its run of Phantom of the Opera in March when a Canadian cast member tested positive for COVID-19. 3 weeks later, the cast was back on stage, but theatergoers have to wear masks, and there are sanitization stops from the door to the auditorium. Canadian theatre is taking its cues from that part of the world.
Theater is essentially a communal experience. Otherwise, we can all sit at home, which we're doing now, and watch things on screens. But that's not the same thing. What happens in a theater and what's magic about it is the energy between the audience and the performers, and the energy between audience members.
And when I knew I'd have to face.
Shalina Kennedy knows all about that. She thrives on the stage and waits for its return.
So I think hopefully this is going to make us all much more compassionate, and the kind of stories that are going to come out of this time, I think, are going to be very exciting.
Up next, costly creatures.
We need to make sure that we're not just leaving those animals without support.
What zoos are doing to keep the doors open and the residents happy.
As the pandemic evolves, we humans are not the only creatures facing a new reality. Zoos and aquariums across the world have gone quiet. Human visitors are no longer allowed. The animals, though, still need to be fed and cared for. And since ticket sales stopped, so has the flow of money to pay the bills. Zoos are under intense pressure to adapt or go the way of the dodo. Tom Hayes explores some of their survival tactics.
It's a trip to the zoo like never before, and the excitement's building.
I want to see the lions, the bison, the grizzly bears. I love the baby giraffe.
That would be baby Longlegs, born just over a week ago at the Toronto Zoo. Normally, she would be a big attraction here with 1.2 million visitors every year. But this year is different.
Go ahead.
Peyton, Jackson, and the rest of the family in the car to take in the Toronto Zoo drive-through.
Because they came forward with a plan that allows people to stay in their vehicles, stage in the parking lot, literally drive through our front entrance, and use a combination of our walking paths as well as our Zoomobile route to get a behind-the-scenes, unique experience.
Say bye, rhinos.
Bye, bye. What's these? That's an alpaca.
That unique experience will generate revenue, but not even close to the $51 million annual operating cost.
I'll just stop. I'm running out of meat.
Attractions across the country are facing a real challenge to keep their creatures fed and doors open.
It's like comparable to a death of a dream, a death of, a passion.
Cherry Brook Zoo in St. John's, New Brunswick closed for good because of COVID-19. The Vancouver Aquarium in Stanley Park is losing $3 million a month. The hope is to open sometime in June with limited tickets, but planning is also underway for a worst-case scenario.
Given that we put aside money to make sure that we can rehome the animals if we need to close, we need to make sure that we're not just leaving those animals without support, and finding new homes for them is going to be a top priority for us. Then that also costs money.
What does the public really want? What would be most critical for them to feel comfortable coming back to us for a safe experience?
The Calgary Zoo has reopened to a limited amount of visitors, but its star attractions, the giant pandas, are on their way home. The zoo can't get enough bamboo to feed the bears during the pandemic, so they will head back to China with no public viewings before they leave. Just outside Montreal, it takes about 30 pounds of meat every day to feed the tigers at Granby Zoo. $500,000 a year to feed all 1,500 animals. With no opening date in sight, the money's running out.
We couldn't expect to be able to run on a 2 month, 3 months maybe basis, and after that it will be really tough. We will probably need the bank help and people like the foundation to be helping us, or at the government level also some program.
The food budget is also an issue here at the Toronto Zoo. It costs over $1 million a year to feed the animals. That $1 million usually comes from parking revenue, from a parking lot that normally doesn't look like this. With no paying guests for the past 8 weeks, many attractions have reached out online.
These guys are from South Africa.
It's a different way to tour the zoo, but the hope is that the drive-through concept will still allow for social distancing and allow families an escape from the COVID lockdown.
Just the ability to get them out of the house and to do something as a family, and obviously to support the zoo and all the employees that have been working throughout to take care of the animals. We're happy to come out and see what it's all about today.
Jackson and Peyton give the zoo drive-through a thumbs up. Finally, getting to enjoy the animals, and it sounds like the feeling was mutual.
I think they were happy to see us.
Coming up.
So I'm going to hug my neighbor Sharon. Happy birthday, Sharon.
The Montreal man building a new and safe way to hug.
Human contact is one of the biggest missing pieces in our new reality, especially for people trapped in long-term care homes or elderly people living at home. We've had to find all kinds of ways to reach out, and some people have taken it to the next level. Alex Montagano built this hugging station in front of his Montreal home. His mom, he said, kept asking for a hug, and so he got creative.
I think it's a way for us to understand the importance, how we're connected together. But I also think that having the physical act of touching another human being is extremely important to us. But you know what? Better safe than sorry.
He hadn't hugged his elderly parents in 8 months. They were in Mexico before the pandemic hit and then in self-isolation. So this was a pretty fantastic way to finally, safely embrace. And that is our program this week. I'm Donna Friesen. We leave you with more pictures from the drive-through zoo. Would you like giraffes with that? Thanks for watching. Take care of each other.